I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hello, listeners. Dr. Fiona Lovely here, and I have a conversation to share with you today that is about health optimization. Because it turns out at menopause and the perimenopausal transition, we get a chance to have a do-over. And really what happens for a lot of people is that we find ourselves facing a diagnosis of some kind, which feels scary, and then we wish we had done things differently. And I'm here to say that is a very common experience, and you don't need to be a victim to that diagnosis. And so I'm bringing in an expert today to share his thoughts and experience as a clinician working with clientele on their own health optimization. So let me introduce Dr. Scott Sherr. He's a board-certified internal medicine physician, certified to practice health optimization medicine, and a hyperbaric oxygen therapy specialist. He is the COO of Troscriptions, a line of physician-formulated pharmaceutical-grade and precision-dosed buccal troches containing novel ingredients like methylene blue, algarin, and others in formulas for energy, focus, sleep, stress, immune support, and more. Now, you know I love my Troscriptions. I've been talking about it in the newsletter. If you're not on the email list, make sure you get signed up to be on the email list, and you go to drlovely.com, and at the very top of the homepage is a place where you can enter your email. And I love this. I love these particular troches. So we do talk about them a little bit in the show, but to continue to introduce Dr. Scott Sherr. Dr. Scott is also the COO of Health Optimization Medicine and Practice, Home Hope, and the nonprofit arm of Troscriptions, which trains practitioners on optimizing health rather than treating disease. What a concept. His clinical practice includes home as its foundation approach, plus an integrative approach to hyperbaric oxygen therapy that includes cutting edge and dynamic HBOT or hyperbaric oxygen therapy protocols, comprehensive lab testing using the framework, targeting supplementation, personal practices, synergistic technologies, new and ancient, and more. Don't you want to know about that ancient thing? We talked about it a little bit. Anyways, we had a great conversation. Scott is one of those people that just has a giant heart, and you can see it walking, which is beautiful. And I love sharing space and time with people like Dr. Scott Sherr, because we have a lot to share when we're open and authentic. Anyways, he does talk about bridging alternative medicine and medicine. We speak a lot about the fact that his dad is a chiropractor, and we have a lot of shared thoughts on things about, what is the standard of health and how medicine has gone sideways a few different ways. And so he brings that expertise along to talk about health optimization. And it's not just about, as he puts it, we set aside disease and we optimize the health measures. Imagine what medicine would be like if that was our standard across the board. And he works in collaboration with medicine, which is really, really important. Now, we do have a conversation. We do talk about hyperbaric oxygen a little bit, but mostly we share some information for you on methylene blue. And if you're tapped into the longevity conversation at all, methylene blue is literally everywhere. And, you're wondering what's the big deal with this stuff? Well, Scott spills the tea on that for sure. He tells us why it's so bioavailable. It's helpful as a mitochondria optimizer to increase energy and increase detoxification. So if you're someone that struggles with fatigue, then perhaps adding methylene blue in could be helpful. Now, this conversation is going to be, some of the information in here is really going to be more useful to you if you can access the methylene blue products like Troscriptions. If you're outside of a jurisdiction where methylene blue can be purchased on the open market, then you may have a compounding pharmacy be able to make it for you. So Scott talks about again the mitochondrial stress that comes along with perimenopause. And in fact, he says, are the symptoms you're having because of hormonal decline? Yes, but are many of them also because of the mitochondrial stress of perimenopause and the neurotransmitter depletion? Fascinating. I learned some things about the GABA system, or the GABAergic system in the brain, that even as a brain specialist, I hadn't heard said quite the way he said it. Now, we do know that progesterone and GABA work together, but there are some other factors there. So listen in for that particular part of the conversation. But I love that we're having the discussion about perimenopause from a holistic point of view. It's not just about hormonal decline, but it's also about the detox pathways. It's about the inflammation that adds up. It's about the depletion of neurotransmitters and other things that make us feel alive and who we are. So it turns out methylene blue can be neuroprotective. It can even help with new nerve growth and improves age-related cognitive decline. So this is part of the reason why I'm very much paying attention to this discussion around methylene blue, because as you know, as dedicated listeners to the show, talking about prevention of cognitive decline is a very, very important focus for me, not just for myself, but for my patients as well, and for you as my listeners. So watch for all the links in the show notes to Troscriptions and Dr. Scott Sherr and the Home Hope Foundation. And I hope you enjoy this episode as much as I enjoyed being in conversation with Scott. Thanks for listening. AG1, the way I start my healthy days. With my AG1, I get a daily dose of vitamins, minerals, pre- and probiotics, adaptogens, and more. It's daily self-care for my busy life. It helps me fill the nutrition gaps, supports immune health, and supports gut for healthy digestion. It's once a day, easy to drink, and packed with bioavailable ingredients in a convenient formula. I am proud to have had AG1 as a sponsor of this show for many years. It's a nutritional supplement I stand behind and I take every single day. Start with AG1 and notice the difference for yourself. It's a great first step to investing in your health. Try AG1 and get a free bottle of vitamin D3, K2, and 5 free AG1 travel packs with your first purchase at drinkag1.com/Fiona Lovely. That's a $48 value for free if you go to drinkag1.com/Fiona Lovely. Check it out. I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. And today I welcome Dr. Scott Sherr. He is a board-certified internal medicine physician, certified to practice health optimization medicine. Ooh, we're going to get into that. And a hyperbaric oxygen therapy specialist. Dr. Scott, welcome to the show.
It's good to be here, Fiona. Thank you for having me. And Happy New Year.
Yes, to you too. And it's so fun to have this conversation. We met in person just a few weeks ago in Vegas for the Longevity Fest. And ever since that, I've been looking forward to this conversation. I thought, what is going to happen today? We're going to get into some goodies. Anyway, so you're an internal medicine physician.
That's true. I happen to be.
How did you find yourself? What a fascinating job you have. How'd you find yourself here?
It's kind of funny. It was almost like a default on some level once I hit medical school, knowing that it was the fastest way for me to finish, but also to be the master of none, in the sense of you get a very wide range of education, but you don't specialize in just one thing. And the way I grew up, as you know, Fiona, my father's a
Yeah.
chiropractor.
Yeah.
He's been a chiropractor for over 45 years in New York on Long Island, and he sees like 800 patients a week, and he's crazy. But he's like
Yes.
the consummate clinician. And so
Yes.
I grew up in his office. It was always very out of the box, always very much looking at things in a holistic way. And had a number of conversations with him when I was looking at going into professional school. I knew I liked science. I wanted to go into medicine on some level.
Mhm.
And he actually recommended that I go to medical school and then figure it out from there. Because having the medical school education, licensure and things like that, it would give me more breadth and honestly, a bigger step in the door. Now, in 2024, does it matter if you have a license? No, nobody cares anymore because you can be a practitioner, and it's actually easier on some level to not have a license because you can't get anything taken away from you on some level.
Absolutely.
But
Absolutely.
in the beginning, it made more sense to me to go to medical school. And so when I went to medical school, it was very, very different than I had ever experienced before, as you can imagine.
Hmm.
But it was a really great education. I went to school in Baltimore, and I really did learn a lot of foundational ideas of what's happening in conventional medicine, which I found very helpful, and I still find very helpful now to this day. But what I meant by the fastest way out is that internal medicine residency is a 3-year program. So you finish 4 years of medical school and you finish 3 years of residency. And then in the US, then you're done. Then you can go and practice and you can do, quote unquote, whatever you want kind of deal within the constructs of your licensure. And so for me, my idea was, can I find a way to bridge this huge chasm between alternative medicine, the medicine that I grew up in, my father's practice, and the conventional world that I was getting trained in. And
Hmm.
so, of course, I got tantalized by things that would allow me to make lots of money very quickly as I was going through medical school and residency, especially in medical school. But I kind of always came back down to my base, which was like, how can I create a a bridge in some way? And so I got involved in hyperbaric oxygen therapy, which is this technology that helps with healing and diving injury and wounds, and that was in medical school. But in experiencing in medical school, I realized that there was so much more that this particular technology could do outside of the conventional system. And so what I did was I finished medical school, finished residency, eventually moved to California where I was for many years, and I really dove into the comprehensive understanding of what hyperbaric therapy could do. And I created integrative practice. And inside that integrative practice, I was working as a medical director of a number of facilities in the Bay Area. And then I created my own online educational consulting business in about 2018, 2019. And during that time frame is when I really learned that I needed much more, and I already knew this, but like I needed much more of a foundation to what I was doing in hyperbaric medicine, because it's a fantastic technology, can do many, many things. It's very awesome. But if you don't have a good foundational understanding of energy and how you make energy, how you detox from making energy, because what we're doing in hyperbaric chamber is giving you a lot more oxygen, but you have to be able to make a lot of energy with that oxygen, or you're going to make a lot of waste products only and make more stress in the system. And so in 2017, I met a really interesting physician who you also met in Las Vegas, named Dr. Ted Atracoso, who created this foundational approach called health optimization medicine and practice, or home hope for short. And that really became the foundation of what I do. It's a comprehensive understanding of looking at a different perspective, not looking at focusing on foundational aspects of looking at root causes of the disease, but looking at for root causes of health and understanding
Mm.
a health perspective rather than a disease perspective. So that became the foundation of my practice. It still is now. So I see tons of people for just health optimization medicine work. And then I still do a lot of work in hyperbaric medicine, always using an integrative approach. And I do it all mostly via telemedicine from my house here in Colorado.
Oh, perfect. Has it ever changed from the time that we graduated to now? And you're right. It's especially speaking to some of the other podcasters in Vegas, many of them don't have a license at all. And
Right.
so they can just say whatever they want. For those of us over here with a license, we're going, yeah, I couldn't say that on the show. But, anyways, regardless, my guests can, which is lovely.
Yeah.
So
Yeah.
I love that I have, okay, as a chiropractor for 20 years now, many times I've run into chiropractic and medicine butting heads.
Sure.
And what I say is that it's unfortunate that the medical world is not is not embracing alternative medicine, as you said, in such a way that ultimately it's about what the patient wants. That's how I always look at it, right? So it's heartwarming to hear that there are people like you in the system that are saying, okay, listen, we can do this a different way. We can look at it a different way. And of course, we've got this sort of antiquated medicine is advanced in so many ways and antiquated in so many others.
Well, I think the key is finding bridges, right? Where are the bridges that really can create more of a pathway or a bridge, obviously, to get people on the conventional side interested in what's happening on the alternative side, and then vice versa, like the alternative side people, like getting them interested in what's happening on the conventional side, because it's not like a zero sum game here. That's really what it comes down to. And when I met Dr. Ted in 2017, and he created this nonprofit called Health Optimization Medicine and Practice. This is something that I signed on to be the chief operating officer of because I felt so strongly that it could be one of these bridges. Because what it was really doing was taking things that I learned in medical school and just kind of flipping on its head and saying,
Yeah.
instead of saying we're looking at all this data to treat your diseases, like your blood pressure, your diabetes, your whatever, like your fibromyalgia, instead we're looking at, well, how can we create a specialty that uses a very similar set of data, but how can we use this set of data to keep people healthy, to
Mhm.
optimize their health and their vitality? Because there's very few specialties out there that are trying to keep people healthy. They're just trying to prevent disease, maybe at early stages, or treat things acutely. And so what Home Hope really was set up, that's what we call it, Health Optimization Medicine and Practice, shorthand, we call it Home Hope, was really set up to do was to try to find a way in so that
Mhm.
conventional doctors like me can say,
Mhm.
okay, this is stuff I learned in medical school, but now we're just shifting the focus instead of focusing on disease. Now we're focusing on health. And
Beautiful.
that's a huge shift. And so many doctors really actually get so burnt out from the meat grinder that is
Yes.
conventional medicine. Like I've worked in hospitals for years as well. All we tend to do in there is get them a better enough so that they can leave the hospital and then throw them into the conventional primary care system, which is overrun. And
Hmm.
the only focus there is like is band-aids on disease and illness and has no time for nutrition, for health, for wellness at all.
Yeah.
So
Yeah.
what we do at Home Hope is we set the disease aside and we
Mm.
say we're going to focus on your cellular health, your gut health, your hormonal health, like your vitamins and your minerals, your nutrients, your inputs, your sunlight, your water, your movement, your relationships. Like if your partner is not a very stress free environment, that's going to be a problem, right? If you're sleeping with somebody that's
Mhm.
snoring all the time, that's going to be a
Mhm.
problem, right? There's
Mhm.
all these things. So we think about it from a health focus, but the big thing here, Fiona, is that
Mhm.
working on people's health takes a long time. It's
Mhm.
not like tomorrow somebody's going to feel better. So this is where Transcriptions, this is where our for-profit company came in,
Mhm.
where we decided we needed to actually create a company that could help people right now while they're on the longer path of optimizing their health. So optimizing
Mhm.
their energy, their stress, their sleep, their immune system. Like you need help right now so that you don't get so challenged along the process of optimizing your health that you stop and give up, or the roadblocks just get too significant for people. So that's where things like methylene blue came in, and working on the GABAergic system, which is our
Mhm.
neurotransmitter system that helps us relax and decrease our stress and help us sleep and things like that. So as a clinician, I want to help people now,
Mhm.
but I also want, so with symptoms, with issues, but we also want to really work on that foundational biology, their foundational health, so that they sustainably have long-term health, while you're working on, putting out fires as you go, that kind of thing.
Yes. Yeah. So basically, what you're talking about is the move from, to use Peter Attia's terminology, medicine 2.0 to medicine 3.0, which is where we're really starting to look at
let's
the.
let's call it health 3.0. Like I want to
Okay.
get, so the problem with Peter, although I think he's a very good educator, is that they're still focused on disease, right?
Yes.
And
Yeah.
that's okay, but if you're not also focusing on health, you are
Yeah.
missing a significant amount of what's going on. The challenge is that Peter and myself, most people, we
Yeah.
didn't learn how to keep people healthy. We learned anatomy for like a hot second, and then we learned about everything that could go wrong after
Yes.
after you were born, basically, or before you, depending on the situation, before you were born. But
Yes.
the problem with people like Peter is that they're way too focused, in my opinion, on
Yes. On the
focusing
disease.
on treating on disease instead of
Yeah.
saying, well, let's keep people healthy. How do we do that? So what we created the first specialty that defines and delivers what a standard of care for health could be, as opposed to what a standard of care for disease could be. So standard of care of health versus a standard of care of disease. It's just a different framework.
And this is the certification through Home Hope is what you're
Yeah.
talking about. So what have
Yeah.
you seen the other doctors that are showing up for the certification? Like where are they arriving from? Share some stories, please.
So it's not even just MDs, it's actually practitioners of all types. So you don't have to be an MD to get a certification through us. If you're a practitioner seeing patients or clients, you have the opportunity to get trained with us to start looking at this health focused type of care. And the people that are coming to us are people that are typically already out of the box or looking to find a way to get out of the box, because they're
Yeah.
tired of the same system. They're looking for a different approach. Oftentimes when it comes to clinicians like MDs and DOs and things like that, they're often themselves failed by the system, or family members of their family members have been failed by the system. So they're looking for other ways to help their family members or help themselves, and they've been failed by the conventional system at large. And so then they do their own research. They're finding out different specialties and what else is out there, and then that's how they can find us. Oftentimes, when it comes to practitioners outside of the licensed practitioners, these are often people that are already self-starters. These are people that are already doing their own certifications. They're doing their own legwork, and they're already kind of really in the weeds of like being an entrepreneur, basically in the health space. And oftentimes they're working on their own health, of course, but they're also very much, these are the people that are really, what's really interesting actually is that they're the ones that have to be super knowledgeable because they're competing with people like you and me who have licenses. So they're usually very, very much upstarters, very highly motivated, and very interested in really this health focused care.
So interesting. So I'm thinking there's a lot of little nuggets that you just dropped in the last 10 minutes or so. And I just
Yeah.
want to start picking up some threads if that's okay. And let's talk through some things. First, I want to ask you to kind of go back to your traditional training in medicine.
Sure.
And how much nutrition education did you get?
I don't honestly remember any,
Okay.
but it probably was minimal. As far as I can remember, there might have been some conversations when we were talking about the cell and the mitochondria and talking about macronutrients and micronutrients, but that's as far as we likely got. I don't have any recollection of any specific conversations about optimizing your health with diet to change your disease. Now, the conversation typically would be very short in the sense of you have diabetics, they're not going to change what they do, put them on medication. I remember one or two conversations about diet and lifestyle for hypertension, where if somebody's hypertensive, they have a new diagnosis, you should try to change their diet and their lifestyle for 6 months before putting them on a medication. And I think that is still part of the criteria when it comes to hypertensive medication. But in general, the answer is that all of my nutrition knowledge came from growing up the son of a crazy chiropractor who was putting us on macronutrient diet, like
Of course he was.
macrobiotic diets and other crazy things. I remember I couldn't have chocolate as a kid. I had carob instead. And
Oh, wasn't it awful? I can taste it in my mouth right now.
so bad,
Ew.
so bad.
So
But
sorry.
on the other end of it,
Yes.
I saw him take kids and adults off of dairy, off of wheat and other kinds of things, and their asthma, their allergies, their autoimmune conditions would go away. So I already had that experience as a kid, seeing this happen in other people, right? In my father's patients. So I knew that, and something that he told me, actually, he and I were just talking about this a couple of days ago, is that he said something to me that was very, very powerful, maybe like the late 80s, early 90s. He said, and this is me as somebody that was a teenager now that wanted to eat what I wanted to eat and do what I wanted to do. I didn't want to do any of that stuff anymore. He's like, Scott, the most powerful drug that you can ever take is the food that you eat.
Yes.
And this is in 1994, 1993.
Not cool at all.
I mean, I'm 14, 15 years old. I'm like, Dad, I don't really care. I'm going to go have a pizza or whatever.
Yeah.
And that's okay, right? And every teenager has to go through that process as far. But I knew how powerful food was, even as a young child, because I saw it in his office. I saw it in myself and what I ate and how I felt and what my skin looked like and all those kinds of fun things when you're a teenager. But in medical school, you learn very little. There's very little interest in trying to change people's behavior at all in conventional medicine, because the default is they're not going to do it. It's just not going to happen. So why should we even try?
Mm-hmm, mm-hmm.
So what we do need to
So,
do now is we need to treat their blood pressure. We need to treat their diabetes. We need to treat their fill in the blank so that things don't get
yes.
worse, because they're not going to change what they do.
Quite often I will come up against something like this in the office with patients, and they'll say, well, I'm trying to think of a good example, and the only one that's coming to mind is thyroid and iodine. And I've asked my doctor if I should take iodine. Okay, now I know that's not a great example because there's lots of sticky bits around that, but I will say to my patients, I will say that is not the person to ask that question of. I said you cannot take your Maserati to the Ford dealership and ask them if they can fix it. They just don't have the training. But of course, we live in a society that has, we put doctors above all else, right? And there's a
Sure.
lot of trust that's given just when you've got an expensive piece of
Maybe
paper
still in
on the wall.
Canada, not in the
Yeah,
America
okay, not
anymore.
so much in the States. Okay. Anytime you need a sponsorship, my friend, just let me know. I did it for
I
my
want to feel
husband. I can do
superior. Maybe I'll come to Canada, but in the America, I don't really get that anymore. So yeah,
exactly,
yeah.
exactly. And by the way, most of the listeners of the show are in the US. So
Oh, good. Yeah. So
just so
they don't believe this, so they'll know what I'm talking about. I mean, it used to be
yes,
that, doctors had this sort of God kind of complex, and maybe surgeons still do,
still
and
do.
maybe for good reason on some level, to some degree. If they're working with brains, they better really be confident that they're going to be working with
Absolutely.
brains. So you want them
Absolutely.
exactly.
Yes. Yes.
But in general, and I think it's a good thing that now what you find is that most patients want to have a collaboration with their providers, with their practitioners, and not be told what to do, in the
Oof.
sense that you want to have more of a relationship with somebody. And
Yeah.
that's what I do in my clinical practice. I mean,
Mhm.
I focus on the health optimization medicine work and what I do with patients long term. And that's a way for me to optimize vitamins, minerals, nutrients, diet, lifestyle, supplementation, everything over long periods of time. And it's a conversation, right?
Mhm.
And I think that's really where I find the most power to be. That's not how it always has been. That is for sure. And then even in the conventional world, it's more difficult to have that conversation because you have 15 minutes with your doctor in
Mhm.
the US with your visit to go
Mhm.
over all the things that you'd like to go over with them. And
Mhm.
it's much easier for them to say, take this medicine, see how you're doing, and let's see you in the office again in 3 months.
Well, and isn't it true that most patients come in going, I saw the ad on TV for this. Can you prescribe me?
That's another
Or,
problem.
or I've Dr. Googled it, right? Which I thought was is a really interesting. It's true. I mean, people do come in pre-Googled, right? It happens in the chiropractic office
It
too.
happens everywhere. Yeah, the Dr. Google thing is dangerous.
It
Like if you
really
have a
is.
hangnail, you're going to die tomorrow. It's a pretty common. Somehow you get through these rabbit holes, and people are like, "Well, I saw this thing on my nose, and I thought maybe it was this, and then I went to Google, and then I realized I had cancer, and then I was going to die." And I'm like, "Okay, that's quite a stretch, but
Yeah.
that's how
Yeah.
it goes." So
Listen,
my deal always with working with people is to try to take it back down to first principles, which is the idea of what are the things that you're doing every day to try to stay healthy, optimize your health. And
yes.
it's very simple, right? Moving, eating,
Yep.
sleeping, relationships,
Relationships. Yep.
water, like the basic things. Like these are very important. And then you take the next level, which is looking at laboratory assessments, and then helping them while you're doing all this stuff with their energy and their focus and their sleep and their insomnia. Some of this is
Yes.
probably pretty common in people listening.
Yes.
Difficulty
Yes.
sleeping,
Yep.
anxiety,
Yep.
depression,
Yep.
energy problems. Like these are things that you can often regenerate or optimize over time, but it can take time to do that. So the way we do this, the way I do this in clinical practice, is working on with various molecules and compounds that can help people right now, like
Yep.
methylene blue, as you know, which I know you're a fan
Yes.
of.
I
Um,
am.
which is a great one. And then there's others that we work on the working on the neurotransmitter system with the GABA system, and others depending on what people need. But I find that most of my patients need more energy, and they need less stress, and they need to sleep better. So those are kind of things that I typically tackle first.
Which is great and spoken like the son of a great chiropractor, right? Like you went in to school knowing all of these things before they gave you the formal education. Okay, so let's talk about these molecules because first of all, I'd heard of methylene blue in the biohacking community, but I'd never tried it until you
Mhm.
guys were kind enough to send me some of the transcriptions product, and I had no idea. I mean, I literally had no idea. It is my favorite discovery of the last year, and I did tell my community this, so they've heard me talk about it. But it's so good to talk to one of the people that was responsible for creating this, is it, do we just call them trochees? Do you want to call them like
Yeah.
supplements? How, talk to us about them, please?
Well, you can call them troches. That's how we develop all the products at Transcription. So we have this dissolvable lozenge that's kind of a square, and it's got a scoring piece in it. So you can cut it up into a quarter, half, or full, depending on what you need. And so all the products are based on this delivery or dosage form. Now, the dosage form and delivery, the troche itself, is something that goes between your upper cheek and gum and dissolves. And what's nice about that is it works very fast that way, and it bypasses metabolism in the liver. So when we digest things, things can get degraded. And what's nice about a troche is that it kind of it prevents all that from happening because it goes directly into your bloodstream directly from your cheek. Now, the issue with methylene blue, as you know, Fiona, is that methylene blue is
Mhm.
quite blue. In
Mm.
fact, it has a very storied history.
Yes.
Methylene blue has been around since the 1870s, actually. It was used as a textile dye to dye blue jeans. And then it was the first drug that was registered with the FDA back in 1897 as a
Wow.
treatment for malaria. But because it's a dye, it dyes things blue. It'll dye your mouth blue. You'll find it'll get your urine blue as well if you take methylene blue. And if you get in other locations, they might get blue as well. But that's another
There
story for
might be
another.
a story, guys. I'm just saying. Keep going.
It's very blue. And
Yes.
so if you use methylene blue as a troche,
Yeah.
dissolvable lozenge, your mouth is going to turn blue. But the nice thing about methylene blue on its own is that it is very bioavailable, which means that if you swallow it, you also get the same mitochondrial benefits, which we can talk about how methylene blue works.
Yes,
You get the
please.
same mitochondrial benefits. If you swallow it, it'll just be slower. So you won't get the same sort of rise as quickly, but you get the same overall general benefits because it's highly bioavailable, which means it doesn't get degraded in your small intestine, in your stomach, and your liver, like most things do. Like a good
Mhm.
example is if you take, excuse me, any supplements for the most part, like I always give the example of NAC or N-acetylcysteine, or it's a pretty common supplement that people
Yeah.
take. It's about 10% bioavailable, which means that
Mm.
if you take 100 milligrams of NAC, only 10% of that is actually getting into your body. The nice thing about methylene blue is that because it's almost 100% bioavailable, almost all of that gets into your body, even if you swallow it. So uh, in a troche, it will work faster, but you can swallow it. But in essence, with methylene blue, the reason why we decided to use it is that it is a fantastic mitochondrial optimizer. What that
Mm.
means in shorthand is that it increases your ability to make energy, and
Mhm.
it also increases your detoxification capacity at the same time. At high doses, it's actually an anti-infective as well. So it can be working, it's an antiviral, antifungal, antibacterial. And back in the 1890s, up until 1950, high doses of methylene blue were used all the time for urinary tract infections, for fungal infections, for bacterial infections, especially with what are called gram-negative bacteria. But really, that all that means is a certain subset of bacteria that are very susceptible to higher doses of methylene blue. But when antibiotics and antimicrobials came around in the 1950s, methylene blue became less used because it had these quote unquote side effects of turning everything blue, like your urine at very
Yeah.
high doses. It would actually turn stool and secretions like your tears blue as well. But
Mm.
this is at doses of like 3 milligrams per kilogram, so much higher doses overall. Now, these lower doses, though, that's where the power of methylene blue is for the most part for most of us, which is improving the mitochondria, improving the ability to make energy, and improving your ability to detox. Now, Fiona, I have a question for you.
Sure. Hit me.
Where in our body do we
How would
have
you
the
blue?
most
Oh.
mitochondria per cell?
Oh, well, I would say the brain, but you kind of gave me the answer ahead of time. But if
I
you just
did.
asked me and not told me, I would have said the brain or
And the
eyes.
brain, right? Or that's a really good, really good guesses, right? So mitochondria are like these powerhouses, right? They make the energy that allow us to do all the things we do. We make this energy currency called ATP. We make about 50 kilograms of ATP per day. So this is
Wow.
a
That's
huge amount of,
bananas.
it's bananas how much actually we make. So it's a
Yes.
huge amount of energy that we make. Okay. And so, but we have some tissues in our body that need a huge amount more mitochondria per cell to make the energy that's required. So the energy requirements are highest in your ovaries if you're female and your testicles and sperm if you're male. Why do we see such huge issues with infertility these days? Is because the mitochondria aren't working as well as they used to be. And there's a number of different reasons why.
Please
Mitochondrial
tell.
dysfunction is extremely common. In fact, in the US, they say that the statistics are about 94% of the US population has some element of mitochondrial dysfunction.
Wow.
Only 6% are mitochondrial optimized. Okay. And this means that you're making energy effectively and you're detoxing from the energy that you make. Because people don't realize that when you're making energy, you made 50 kilograms of ATP today, you have a bunch of waste products that you've made from all that energy too. Now, some of these waste products are benign. Uh, Carbon dioxide, we breathe it out. Water, but we also make a tiny amount of reactive oxygen species, these free radicals, these inflammatory molecules that can build up in the system, and we have an antioxidant system in our body that helps neutralize those antioxidants. Okay, neutralize that oxidative stress. So you have those reactive oxygen species that get built up, and you have antioxidants that neutralize that. So mitochondrial dysfunction happens when the mitochondria can't make energy effectively, or it cannot detox from the energy that it's making. Now, the most common reasons, the number one most common reason is insulin resistance. So if they're insulin resistant, you're going to have issues with energy production and detoxification. There are medications that people take that also affect mitochondrial function. The most common one actually is metformin, interestingly enough. Even though it's been used as a longevity drug, there's also some destruction on complex 1 that it does as well. Then there's also toxins in our environment. Tons of toxins in our environment that are causing mitochondrial destruction. This can be from things that are in food, things that are in water, things that are in cosmetics, things that are in the air that we're breathing, all affecting mitochondrial function. And there's also infections. Infections also can significantly impact mitochondrial function. This could be things like COVID or Epstein-Barr or Lyme disease or an acute viral infection or mold. Like all these are going to affect mitochondrial function. So it's a huge bucket of things. And so 94% of the US population has some element of mitochondrial dysfunction. And so what we're thinking about here is when we have the most mitochondria per cell, you're going to have a dysfunction in areas where you have the most mitochondria that are required to make that cell or that tissue work better. So you have your ovaries and your testicles, infertility. If your brain, which has the second most mitochondria per cell, is having issues, you're going to have issues with brain fog, with concentration issues, with memory issues. And so this is
hello,
huge.
menopause. Like you just described what perimenopause feels like, by the way.
Yeah,
So
exactly.
brain
Right.
fog. Okay.
Yeah,
Yeah.
brain fog, concentration issues, fatigue, memory issues. All these things are ongoing. Then you also have issues with cardiac issues, and we have detoxification, and then musculoskeletal tissue. Your muscles have a huge amount of mitochondria in reserve, so that you can run when you need to run. At least evolutionarily, if you can run from an animal that was trying to kill you, right? And so you have a huge amount of mitochondria. So this is when people have exercise-induced fatigue, so that they go for a run or they go for a walk and they can't move for 3 to 4 days or even 24 hours after they've done it. This is mitochondrial stress overall. So what I think about here, sorry.
Yeah. Yes. It's fascinating. So recovery is part of this conversation then too, when we're talking about
Huge. Yeah.
exercise.
And so for me, when it comes to mitochondrial function, what you really want to be doing is thinking about how you can optimize the mitochondria, looking at energy inputs, your macronutrients, your fat, your protein, your carbohydrates, your micronutrients, your B vitamins, your antioxidant system. This is what the health optimization medicine framework is all about. However, what you need to help people right now, I need to help people right now to make them feel better. And so this is where methylene blue comes in, because it can enhance the capacity for your mitochondria to make energy. And at the same time, it can also help with detoxification. It can help with the capacity to neutralize inflammation, neutralize reactive oxygen species. So you have this, it's very unusual to find a compound that can do both. Usually one compound is going to help you make energy, and another compound is going to help you detox. So your vitamins, your vitamin A, your vitamin D, your vitamin C, your melatonin, these are all antioxidants. They don't help with energy. And you have things that can help you make more energy, like caffeine or nicotine, or even things like L-tyrosine, which is an amino acid that can help with some of the neurotransmitters that help produce some of these energy production capacity, or increase your energy production capacity. But there's very few things that do both. There's very few things that will give you energy and also help you with detox at the same time. And that's where methylene blue's power is. And that's probably what you've seen when you take it, I would imagine.
Yes.
Tell me how you feel when you take methylene blue, Fiona.
Well, I have to say it's I've struggled with brain fog. That's been one of my big symptoms of perimenopause myself, and sleep issues, although that is better. But there's been few things that move the needle on brain fog. And as you can imagine, I'm sure you're the same way. My brain is basically my entire world, right? My businesses, you name it,
Sure,
right?
sure,
My certainly relationships and all of those other things. But if I don't have like that quick thinking, especially when someone's asking me a question in clinic, then what's left, right? So, and this started the year, the 2020 year. I think the stress of the pandemic was
sure,
probably the biggest catalyst there for me. So anyways, I have tried a bunch of different things for brain fog, and I had heard that methylene blue is good for brain fog, specifically the transcriptions, blue carnitine and true blue. And I thought, okay, well, I'll give it a try. And I had been warned about the blue mouth and all of that, so I was somewhat prepared for that conversation
sure.
or that bit of it. But I shocked at how, like, literally it's like my the lights turned on in my brain like real fast. Now it's interesting, I've taken it because I try to bypass, if I've got an interview or something, try to bypass the blue mouth and swallow it. It's not the same. It's different, you're right, it's so different. But then when I tuck that little trochee in there, man, it's like, look out. Like, I almost feel I'm at the point now where I literally have to clear all the clutter away, because the minute it starts working, I can just get. I mean, people talk about ADHD medications having the same effect if they've been undiagnosed for a long time. I don't have that experience, but it's
Hmm.
like the lights get turned on. I'm like, oh shit, get out of the road if you're not stapled down or pinned down. Mama's coming through and her brain's on. So that was been my experience with it, and especially with the blue carnitine. Holy cow, it's some
Yeah.
powerful medicine.
So that one specifically is definitely better to dissolve in your mouth. It has a combination of the methylene blue with nicotine, caffeine, and CBD together. So that is the first product we came out with back in 2020. And we were actually the first company to come out with a methylene blue containing commercial product. And this is right before the pandemic. This is in February 2020.
Wow.
And so blue carnitine was developed to be exactly as you describe. It is like snapping your fingers and like going, holy shit, now I'm ready. And we did it in a way that's very novel. Using methylene blue is obviously novel,
Yeah.
but using nicotine is also pretty controversial. And
Yes.
but the beautiful thing about nicotine is that very low doses of it are very safe. They're non-addictive. They increase your cognitive capacity, memory, learning, skill
Mhm.
acquisition,
Mhm.
etc. And they're also very it's very quick acting. So like you feel the nicotine very quickly. So your brain is all of a sudden like turned on in a couple minutes after.
Yeah.
I mean, if you dissolve in your mouth with the blue carnitine, in about 5 to 10 minutes, you will start feeling the effect for most people.
Yes.
Now, a good story is that I was doing some sort of interview and I was showing that you could swallow the blue, the just blue, in this case, the pure
Mhm.
methylene blue. And I was like, you can just swallow it. It's no problem. It's going to take a little bit longer. You're going to have a more slow rise to effect. But if it's a systemic mitochondrial issue, then you're going to still really see the benefit. I forgot I had taken the wrong one. Instead of taking a full just blue, I took a full blue carnitine, and this is about 5 o'clock at night. And I was up until 3 o'clock in the morning. I felt
I bet you
fantastic.
were.
I was just like going like this and doing all my work, and I couldn't stop. And then I finally had to take some GABAergic stuff later to calm myself down, some Trozy. But
Yeah.
so it still worked. It was just about an hour later, I was like, why am I so wired? I was trying to figure out why. My dose of blue carnitine is a quarter. So I take a very
Yes.
small amount of it, and I took a full one. So,
Yeah. Oh
but
boy.
but one point that I wanted to make there too is that if you're having more brain related symptoms, if you're having more brain fog, if you're having more cognitive issues with memory, attention, focus, it will be better to dissolve it in your mouth because of how fast it's going to work. And the glucanatine itself, because it has nicotine, caffeine, and CBD there as well, the ingredients are going to be more bioavailable in your mouth as opposed to being swallowed. So you're going to get more bang for your buck as
Mhm.
a troche, as a dissolvable lozenge, as opposed to swallowing it. So yes, you could be like me and accidentally swallow a blue carnitine. It's going to work, especially if you take triple your usual dose, which I did. But I would tell people if they're going to take a blue carnitine
Yeah.
and swallow it instead of dissolving in the mouth, number one, try to have it on an empty stomach. That's usually
Mhm.
better.
Mhm.
And number two, you might need to increase your dose slightly. So if you're at a half of a troche, typically you might want to take 3/4. And then
Mhm.
number three is that if you eat about 15 to 20 minutes after taking your blue carnitine,
Mhm.
you will get a kind of a push of the ingredients into the system faster, I found, and you'll get a faster effect that way. So those are my three
Interesting.
ways. So if you're going to swallow our pure methylene blue, you don't need to increase your dose, but I would have people do it on an empty stomach and then eat about 15 to 20 minutes later to kind of push it through in the same way you would have done the blue cannatine in that capacity.
Okay. And why would we take the True Blue versus the blue cannatine? Like give us that information, please.
So the blue cannatine is more for targeted focus, getting shit done for 3 to 5 hours.
It
It's
works a
also
hot damn. Sorry to interrupt. I have to say that again.
I love it. I love it. And that's what it is. It's like being on Adderall without the jitters, without the come down and crash. And instead of being for 8 to 10 hours, which Adderall is, it's about 3 to 5 hours.
Hmm.
And so we have people that use it for targeted focus, for targeted getting things done, for shorter periods of time. It in people in people do have ADHD that are taking Adderall. It can be a replacement for that. If you're thinking about doing that, I always recommend working with a practitioner, weaning yourself off, or with the help of a practitioner, weaning yourself off of some of the ADHD meds. But as a clinician in my practice, what I do is I will have the blue cannatine as a replacement, and it will slowly decrease their Adderall or Vyvanse or whatever dose, increasing them on the blue cannatine as a replacement overall.
Mm.
It really does work that way. Sometimes what people with ADHD will do is they'll take their Adderall, their amphetamines 5 days a week, and then on the weekends they'll stay off of it. So what I'll sometimes have them do is try the blue cannatine on a weekend when
Hmm.
they're not usually taking their Adderall and see how they feel, and then kind of find the dose that seems to work for them.
Hmm.
So in essence, blue cannatine, our caffeine, nicotine, CBD, and methylene blue combo are for targeted focus, getting shit done.
Hmm.
Whereas the Just Blue, our pure methylene blue at 16 milligrams, is a higher dose of methylene blue. There's only 5 milligrams in blue cannatine. There's 16 in the Just Blue. Just Blue is a mitochondrial optimizer. It's going to help with energy and resilience and detox. And so, but it's not going to give you a stimulated kind of feel. So blue cannatine is going to give you a stimulant kind of feel, whereas methylene blue by itself, or Just Blue, is going to give you more of like an energetic rise. You're going to feel like you have more energy. You're going to feel like your mood is a little bit better. You're going to feel more engaged, but you're not going to feel overstimulated or feeling like you're going to have a hard time going to bed typically. So in a lot of patients, what I'll do that have issues with focus on the Adderall ADHD spectrum is have them take blue cannatine in the morning, and then I'll have them take a Just Blue in the afternoon, early
Mm.
afternoon, because that'll keep them going, keep their energy going, keep them having more of that focus. But that second dose is not blue cannatine, which has caffeine in there, which may keep them up later at night. So
Hmm.
I'll use it that way. I'll also use a lot of Just Blue in my people with chronic mitochondrial dysfunction. So this is people with long COVID symptoms, with fibromyalgia, with chronic fatigue, with autoimmune problems, with just chronic issues with brain fog and
Hmm.
energy, and issues with exercise induced fatigue.
Hmm.
These people do great with lower doses of methylene blue. And what I'll do with these people, Fiona, is I'll
Hmm.
titrate their dose over time,
Hmm.
usually starting them off at maybe a quarter of our troche, and then increasing their dose every 3 to 5 days until they start feeling better, until they start feeling their symptoms are improving. Once they find that their symptoms are getting better, then we keep them at that dose. For how long depends on why they're taking it in the first place. So if they
Hmm.
have a severe chronic issue, it might be on for weeks or even months before we start weaning down the methylene blue dose. But if it's more for something more acute, then we may be able to wean it down much faster overall. But in
Okay.
general, with pure methylene blue, I find it's a titration game until you can find the right dose for you. And then once you find that dose, then you can use that dose daily initially if you need to, or you can use it periodically depending on the situation.
Hmm.
For example, on the periodic side, I use a lot of methylene blue in my endurance athletes as well, in people that are traveling a lot, because it protects from being on an airplane. It's radiation protection. It protects your mitochondria from low oxygen states being on an airplane, et
Yeah.
cetera. So we
I
have
was going to
travel
ask you about
protocols.
that.
Yeah.
Yes, I was going to ask you about that because oxygenation when you're on on the airplane. Actually, someone gave me the heads up when I was on my way home, on my way to the airport when we were in Vegas, and said, "Make sure you take your Just Blue."
Yes, yes,
Yes,
because
let's talk about
because
that.
when you're on an airplane, you're pressurized to about 8,000 feet above sea level. So most of us live at sea level. I'm actually at a benefit. If you live in Colorado like I do, I'm at 5,000 feet here. And so when I go on an airplane, the change there is only about 3,000 feet. But if you're coming from sea level, that's 8,000 feet elevation. Your body's like, what the hell did you just do to me? Like, I'm at low oxygen levels. You're more susceptible as a result of that to infection, to feeling like shit when you get to your destination. A lot of jet lags related to that hypoxia. And so, what methylene blue can do, which is super interesting, and I didn't mention this yet, is that it can act just like oxygen in your cells, which means that if you have less oxygen around, methylene blue can act just like oxygen. And so, this begs the question, what is oxygen required for? Oxygen is required for you to make that ATP, that 50 kilograms of ATP, that energy currency you make all day. If you don't have oxygen around, you can't make energy. And so if you have a lack of oxygen, you're going to make less energy. If you have a lack of energy that you're going to make, you're going to have more inflammation in the system. And more inflammation is going to cause more stress and is going to deplete antioxidants, and you're going to be more susceptible for infection. And the circle goes around of terribleness as you fly and get jet lag and all those kinds of things. And so what methylene blue can do, it can act just like oxygen. So like if you don't have enough oxygen around, you can use methylene blue as an oxygen replacement. And this is why it's also been studied in things like traumatic brain injury, in stroke, in cardiac disease as well, because it can save tissue from dying if you give methylene blue acutely. So I always go down all these roads, but in my patients, what I have them all do is they have higher strength methylene blue in their medicine cabinets just in case. If they have a acute issue where they have acute low oxygen state, obviously a stroke, a traumatic brain injury, but even if they have a musculoskeletal injury as well, where you're going to have hypoxic tissue, then I have them take higher strength methylene blue acutely so that they're protecting tissue from dying or from being severely injured in the process. So you have this amazing capacity for methylene blue to be this it's called the final electron acceptor, just like oxygen in the mitochondria to help you make energy. So there's a lot of benefits from that. It's from an endurance perspective. My endurance athletes can keep their heart rate up for longer without having to stop because they have methylene blue around. I'm traveling on an airplane. I have more capacity to make energy, even if there's less oxygen around. If I have a severe injury, I have more capacity to make energy, even if there is a difficult time doing that because of the injury that may have happened as well. So it's
interesting.
Obviously very versatile here as what we can do.
Yeah, I'd say I'm sort of checking off lists in my brain, of the people who I know that could benefit from this. Hello, anxiety, my old friend. Do you ever find yourself replaying the same thoughts over and over, like a bad Spotify playlist you just can't skip? Or maybe you've been reaching for that nightly glass of wine to unwind and de-stress, but it causes you to wake up at 3 a.m. feeling regret for drinking it in the first place? I totally get it. Life is busy, your mind is racing, and stress is your unwelcome plus one. Enter Trocom by Troscriptions. It's like a reset button for your brain, but better. These little troches dissolve in your mouth, helping to take the edge off, quiet the noise, and stop those incessant late night thoughts, leaving you feeling calm and collected. And guess what? It's a guilt-free replacement for that wine. It'll help you relax without messing with your sleep. Whether you're juggling work, family, stress, or just trying to steal a few moments for yourself, let Trocom bring your chill back on demand. Visit troscriptions.com and try it out today. Your mind and your sanity will thank you. Use code LOVELY10 for 10% off your order. Thanks, Troscriptions. We've talked about this a little bit. You've mentioned it a couple of times, but sleep is a real issue for women in perimenopause.
Sure.
And I know it was for me too. Like I said, that one's pretty good now, but for a lot of years, just low quality sleep, especially in my late 30s and early 40s. And so, what is there a methylene blue appropriate conversation to have around sleep?
So yes, of course. But this is kind of a cool little segue that you're giving me as well, which I like, is that so much of the issue that we find, so many of the issues that we find that when we're going through transitions like menopause are related to mitochondrial stress overall. And this is because hormones are changing. Inflammation is not going to be managed the same way. You're going to find that there's a significant amount of mitochondrial stress. And as a result of that, it's sort of like a downward spiral where it's like things are very difficult to manage if you don't manage some of the underlying reasons why things are happening, right? And so the way I think about this is kind of in a twofold manner. I think about mitochondrial stress, and then I think about neurotransmitter repletion, because what happens during menopause is obviously is that we have significant changes in our hormones, especially estrogen and progesterone. And so progesterone specifically works on a system called the GABA system in our brain. It does multiple things, of course, but progesterone works on the GABA system. GABA is the brakes of our brain. It helps relax us. It helps us fall asleep. It helps us stay asleep. And when we don't have enough progesterone around during menopause or perimenopause, you're going to have
which is
issues.
Everyone. So whoever's listening, it's literally every woman at some point is going to be low progesterone. It happens first. Anyways, go on.
Yes,
Please.
totally. Yeah. And so if you're having a shitty time with
Yeah.
sleep, it's all, and you're going through menopause,
And
it's
anxiety,
very likely. Yes,
progesterone. Yes.
exactly. And that's also because the GABA system is responsible. If you're GABA deficient, if you're low on GABA, you have a higher risk of depression, anxiety, insomnia, and everything that goes along with those things. And so when you're going through menopause, you are going to become GABA deficient because your hormones are not going to be supporting the GABA system. So it's extremely important to be supporting the GABA system in other ways. HRT is obviously one way, going on hormone replacement therapy to work on and giving you progesterone back. But when I think about sleep, I'm thinking oftentimes not only on the hormones, but also on the GABAergic system itself. And so GABA, again, is a neurotransmitter. It takes up about 20% of the brain's neurotransmission. So it's a huge amount of neurotransmission that is responsible for calming down the firing of the brain. Okay. And so GABA is made from another neurotransmitter called glutamate. Glutamate is our primary excitatory neurotransmitter. So it's the one that keeps us going and revs us up. Everybody knows about norepinephrine and dopamine and serotonin. Like those are our superstar neurotransmitters, let's call them, where you have glutamate and GABA together are 80% of your brain's neurotransmission. So everything else is 20% of that compared to that. So that's a huge amount. And what happens with menopause and perimenopause is that your system gets completely lopsided and you have too much glutamate and you have too little GABA overall. And that glutamate is the excitatory one. And estrogen actually enhances glutamate as well. So if you have estrogen dominance, like this is also an issue, as you know, where you have a lot of, estrogen is good, obviously, but having too much estrogen compared to and then increasing the amount of glutamate as a result. So you have too much glutamate compared to GABA is going to dysregulate this whole process, especially when you have glutamate actually being converted into GABA in the brain. So that's the only way you really get GABA is by this conversion of glutamate over to GABA. And so you have this overabundance of glutamate. The common scenario that people can remember is going to a Chinese restaurant and having MSG in your food. That is just a huge amount of glutamate all of a sudden. If you're going through menopause right now, you may feel like you're always on MSG, basically. So
I have never heard anybody say that, Scott, and I think that's actually a really good analogy.
It's a good analogy.
Yes.
Yeah. And so when I think about optimizing the GABA system, I think about the conversion of glutamate to GABA, number one, and that's actually vitamin B6 and magnesium. So many of us are deficient in those particular nutrients. So making sure you're getting good B6, magnesium supplementation, but then how can we enhance the GABA system itself? So it's really an increase the amount of GABA in there. The problem here, Fiona, is that you cannot supplement with GABA directly. GABA supplements don't work.
No,
if they do work, it means that you have a leaky brain. All that means is that you have a blood-brain barrier that's not doing what it's supposed to do. So our blood-brain barrier is supposed to keep things out that shouldn't get in. But unfortunately, with GABA as a supplement, GABA is too big of a molecule to get across. But if you take GABA supplements and GABA works, this means that that brain barrier is not doing what it's supposed to do. And if you have a leaky brain, it often means you have a leaky gut. And so you have to address the leaky gut itself. And then if you address the leaky gut, everything else gets better. So what we do at Transcriptions is that we found ways to enhance the GABA system without using GABA directly. So we use things that work on the GABA receptor to enhance GABA binding. And then we use things that actually bind to where GABA would bind on the receptor in combination. So they're called allosteric and orthosteric. It doesn't matter. But the main thing here to know is that things like kava, CBD, CBG, CBN, Hanukkah, which comes from magnolia bark, these are all working on the GABA receptor to enhance the amount of GABA that can bind. And then we have something called nicotinyl GABA, vitamin B3, attached to a GABA that does get across very easily, that we use in something called Trocom. Trocom has nicotinyl GABA with kava, CBD, and CBG together. And this combination, the nicotinyl GABA gets across the blood-brain barrier because it has a vitamin B3 attached. And then it increases GABA because it's able to get across with the vitamin B3. So you have a little bit of B3, which is mildly activating. And then you have the GABA, which is relaxing. So Trocom is great for anxiety, for stress, for tension, without making people feel tired because it has that minimal amount of vitamin B3 in there, which is mildly activating. So you can give like a quarter to take the edge off. We like to say that it's from the boardroom to the bedroom, Fiona. So in our
Yep.
from a performance anxiety perspective, from our males that are listening, or the women that have male partners,
Yes.
an erection
Yes.
is parasympathetic.
Yes.
But ejaculation is sympathetic.
Yes.
So if you can keep yourself parasympathetic for longer, you are going to last longer.
Are you saying I need to give my husband the whole box?
The whole box. Yes. And then we've actually have tons of reports of this actually.
That's fascinating, actually.
Yeah. So that's why I say from the boardroom, because if you're super stressed during the day, you're going to forget what you're going to do, what you want to do, what you wanted to say. But if you can just take the edge off a little bit, your brain's going to come back online and you're actually going to perform better. So a quarter of a Trocom can go a long way, but a half or more can be better at night or for performance related anxiety. The other thing I like to remind people is that on average, we have about, do you know how many average thoughts we have per day, Fiona? We didn't talk about
Wasn't it like 36,000?
70,000.
Oh my God.
On average, we have about 70,000 thoughts per day. And if you're anxious or depressed, you have on average about 120,000 thoughts per day.
Wow. I did not know that. And it totally explains it, doesn't it?
Don't believe everything or maybe anything that you think, right?
Yes.
I mean, and this is what I talk to my kids about all the time. It's like your brains are going to say, are going to think ridiculous shit all day long.
Yes.
And
don't believe it.
Don't believe it. I mean, this is just what the brain is really programmed to do, is to keep you from dying and when you're past puberty, to help you procreate. Like those are the only two things that your brain are really trying to do. And so 70,000 thoughts a day is a lot already, but if you take something like Trocom and optimize the GABA system, you can bring those thoughts back down, because the thought craziness, the thought salad, the thought diarrhea, let's call it, is a better way, is everybody has that, but the
Scott,
GABA...
I call it mental masturbation, by the way.
Yeah, totally. Mental masturbation with a side of diarrhea, let's call it.
Or mental gymnastics, depending on who's listening. But anyways, go on.
No, totally. And so the GABA system is responsible. The GABA system is responsible for regulating the thought generator, your brain. Yeah. And so if you can get the GABA system online, you're going to feel so much better. And so we also have something called Tro-Z, which is for sleep. And that has a number of things that bind to the GABA receptor. But one very cool one that binds to where GABA binds, called Agerin, which is a long-acting GABA agonist. So it works on the receptor. It's from the psychedelic mushroom, the Amanita muscaria, or the fly agaric mushroom. And it's not psychedelic. Okay. This mushroom itself is neurotoxic, and that's why it causes psychedelic experiences. We just passed Christmas. It's also associated with Christmas and shaman in Siberia. People are interested. They go to New York Times. They can read all about the Amanita mushroom and Christmas. But anyway, we use this one ingredient called Agerin because it works on the GABA receptor. It stays there for about 6.5 hours. And so you get long-acting GABA tone so that you can fall asleep and you can stay asleep. And people that wake up in the middle of the night, like a lot of women do when they're on going through, it's because of that GABAergic issue. They have the Tro-Z on board. They can maintain their sleep, or if they do wake up, they can go back to bed, which is obviously ginormous. And so sleep is a big issue, and progesterone is a major part of that. And so, supplementing with progesterone can be very, very helpful, as we know, but also working on the GABA system, working with the conversion of glutamate to GABA, so B6 and magnesium, along with some of these supplements that can enhance GABA itself without being GABA directly, because GABA supplements, as I mentioned, do not work.
No. Well, and the sleep issue for women in perimenopause is, there's lots of layers to it. And I think uh we're doing a pretty good job now of understanding the role of progesterone in that whole experience. But you've just explained a whole bunch of other levels that are so helpful, things that I know I will take to my patients tomorrow and share, because it's whatever we can do to sort of prop up these processes. And as I like to remind people, because I get this question a lot, well, why are we trying to figure this all out for women? Like, why did our grandmothers never talk about this, or our great grandmothers, or whatever? Well, for our great great grandmothers, their life expectancy was 51.
Right.
So we're figuring out this stuff like literally live. And of course, my generation, your generation, we come along and we are not willing to be quiet about it. We're saying, we're demanding change happen. By the way, just to circle back to the earlier question, how much did you learn about menopause in your training?
Oh man, I can't remember any. I'm sure we remembered. I remember talking about how all the hormone cycles stop.
And
That's
that's
it.
it.
That's it.
Yeah,
Yeah. That's
that's
it. Yeah.
bananas, right? You get that
Yeah.
that's just crazy, right?
It is crazy. And I think you said it really well that we live so much longer now. I mean, we were optimized to live until about 35 to 45 years of age, because that's how long we needed to live so that we could procreate and that our kids were old enough that they didn't die when we died. We died of infection, we died of food starvation, there are lots of different reasons why humans would die out. So trying to optimize these meat suits that we have, these avatars that we carry around, requires more work after these ages. And this is what I tell people all the time. It's like, if you want to be optimized at 75 years old, you need to probably be taking hormones. You need to be on vitamins, minerals, and nutrients. Your system is just not able to do the things that it could do when it was 20 to 30 years of age. And that's what Home Hope is all about, actually. The health optimization medicine framework is trying to optimize you for levels that you would have had between 20 and 30 years of age. Your vitamins, minerals, your nutrients, your hormones, because that's when you're most optimized to procreate and to be resilient to all of life's stressors. And so the deal for us is to optimize health rather than treat disease. The deal with us is to optimize our levels of nutrient and hormone networks to between 20 and 30 years of age. And when you're thinking about the GABA system and you're thinking about mitochondrial health, these are all part of that, and very, very much as an interplay. As you're trying to do all of that, you really want to support the system with, the foundational things, but then also help with things like methylene blue and the GABAergic system. We need to be thinking about these things now, because thankfully we live much longer than 51 years.
Yes, thankfully is right. I feel like I'm just getting started. It's just getting good, you know?
There you go. Yeah, I feel like it too. Every year is better.
It is, it's true. And this is especially
It
true of
got
my
worse for a
menopause.
little while. I'm not going to be. I'm going to be honest. Like it got worse before it got better. Like when I started having kids at 30, and like until I was about 37, I was like, this is good. I mean, I was tired,
Yeah.
didn't have any problems, and then I like between like 38 to 42, I was like, okay, I really got to be starting to take care of my shit.
Yes.
And then
Yes.
since I've done that, I'm like, okay, we're back.
And you're good.
So,
Yeah, yeah. And of course, medicine knows even less about andropause than we do
true,
about menopause, right? At
true.
least there's some information about menopause, but to talk about the male menopause as it's referred to, I mean, it's just as profound for you guys. It's just
Slower.
things are,
Yeah.
yes, it's
Yeah.
slower, of
It's
course,
a
and
slow decline after about 30 years of age. Yeah. And I tell all
yes.
my, like, I tell all my clients that are, then 50, 60, 70 years of age, like there's only so much that you're going to be able to do naturally. At some point, you're going to have to take exogenous hormones as well if you want to feel like you did between 20 or 40 years of age. And the key, just to make sure that you're monitoring things closely so that you're not overshooting and that, you're not, putting anybody at risk. And so the key with all of this is that, like, I think TRT is bullshit is what it comes down to. Like, no, yes, testosterone can be helpful, but you shouldn't just be taking testosterone as a male, or even and male and female should be taking testosterone too, as you know. And
Hmm.
so it's about a balancing network approach. And that's
Hmm.
why home hope is so important to what I do, is that it's not just looking at one hormone or one nutrient. It's like, yeah, you should take more glutathione. You should take more B12. You should just take methylene blue. No, like you really should be thinking about these things in a much more networked context. And that's where you're going to see the power and the
Hmm.
sustainability of the things that we're doing.
Yes, yes, I'd say. So I know I have a lot of fans of the show that are also health practitioners,
Okay.
and they're
Yeah.
probably going, I want to know more about this home hope business. So
Yeah.
where do they find out more information about that? Your
So we have a
certification.
website. It's at homehope.org, and we
Okay.
have a 7 module certification for practitioners, both licensed and non-licensed. Our primary foundational module of the whole thing is called metabolomics, and metabolomics is the study of cellular metabolism, of understanding vitamins, mineral nutrients, and cofactors in real time. It's fantastic, and it's a 12-week module. We do a cohort style about 3 times a year, where you get to meet with the faculty every week and a small group of students. Our next one's actually going to be in middle February, if anybody's interested. And we have about 10 to 20 students that typically sign up, that'll go through a cohort style meeting with faculty, going through the lessons, going through clinical cases and pearls, and we have case presentations and things like that. And so, as I mentioned, you don't have to be licensed to do this. If you are I would say, if you're an upstart person that's very motivated and interested in biochemistry, you can absolutely do this. And what I love about it is it doesn't take the place of any other medical specialty out there. If you're doing conventional medicine, if you're doing even integrative medicine, and you're
Mhm.
looking for more training at foundational health markers and a shift in perspective to health, a shift in perspective as things are a network and that we're optimizing between 20 and 30 years of age, like this is a specialty you definitely should consider.
Okay, I love it. Well, I love the information you've delivered today. First of all, as the bridge between integrative medicine and conventional medicine or Western medicine, I've heard it referred to as just there's such a rich conversation to be had here, Scott. It's so fun to be in the and play in this with you for
Yeah, I
sure.
talk out of both sides of my mouth. That's what I always say. It's like, you want to talk about oncology and whatever, I can go as in depth, I mean, as much as I can with colleagues in the
Yes,
conventional world. But I think the key is that there needs to be more people like me, and there more people are,
yes,
where it's like they have a conventional training, but they know the alternative world. And if they don't know it, it's like, I don't pretend to know everything. I just have a relatively large network of people that I can call and say, hey, I have this, this crazy oncologic case. I've started to do some work with them. I'm doing some home framework, but they also need integrative oncologic care and like a crazy clinic in Mexico to do something that I don't know about, that you know about, or whatever. So
yeah.
I think the way the world is working now, Fiona, is that
Mhm.
if you if you can get it, like if you're a practitioner, having a foundational approach can be transformative no matter what you're doing, and then creating a network of practitioners around you that can really
Yes,
be helpful for for targeted,
absolutely.
for other kinds of things that you don't do.
Yeah,
At least that's what I've
absolutely.
done.
Yeah, absolutely. And this is what I impress upon the young practitioners that are around me too, is you are not going to do this. You are not one person. You are not going to take care of every single person in the practice that comes in. You need to have good people around you. And when you are out of your league, then just refer. In fact, patients love it. It's a co-care. It should have always been this way,
That's how
right?
I always operate. Yeah.
Yes, me
And I
too.
think they always appreciate it. Like, I just came off the phone with somebody before our podcast that needs better oncologic care and some novel things. And I refer them over to a friend of mine that has a clinic in Tijuana that's doing intravenous lasers and crazy stuff. Right. And so
Awesome.
I don't know about that stuff. I just refer over to people that
Yeah.
I know have had success. And so I'm 100% a collaborative practitioner. And that's how I think about my own clinical practice when I work with patients, for sure.
Mhm. And how you would wish to be treated yourself.
Of
That's always an
course.
element of it too, isn't it?
Of course.
Okay, so the women listening to the show, I guess there's dudes that could be listening to the show too, you never know, and they want to know more about the products that we talked about, the Transcriptions products. Where do they find out more information?
So our company is called Troscriptions. It's the letters TRO and the word prescriptions without the beginning of the word prescription. So it's Troscriptions. TROS, Troscriptions, Tro prescriptions with the P. I'm making it more confusing. Just look up Troscriptions. It's fine. I don't know why I'm
It's
trying to make it so much more difficult.
all good. I'll put the link in the show
Yeah,
notes. You're all
yeah.
good.
And so if you find us, you can find us on Instagram at Troscriptions. You can find us on our website, troscriptions.com. Tons of blogs, tons of information and education. If you're a practitioner, we also have a practitioner portal where you can sign up and you can learn about all of our products from a clinical perspective. So things that we can't talk about or claim from a non-practitioner side, but clinical resources, webinars, interviews on all kinds of things
How
that we've
come
been
I'm
talking
just
about here.
hearing about this now?
Well,
I got it.
then now,
Yes,
then now you
I'm
know.
going to sign up.
And for those of you that are in the US, you
Yes.
can get a wholesale discount if you're a practitioner, so you can sell it in your office or you can drop ship to your patients as well, if that's an option, depending on how you practice. And
Yes.
so we also have a couple of practitioner-only products as well that are only available to practitioners in the practitioner portal. So we have a higher strength methylene blue called Tro Plus Blue, and a higher strength, one of our other products called Tro Plus Immune, which is for immune system support, which is fantastic as well, so that you can only get that as a practitioner. So you go to troscriptions.com, and as a practitioner, you can find out the place to log in or to sign up for a practitioner account. But for everybody else, we have tons of information for everybody, non-practitioners as well. Our website has tons of information. Our Transcriptions Instagram page has tons of information too.
Cool. Thank you. Well, thank you for your contribution to medicine and to humanity more than medicine, even more, right? Thank you for taking care of the people. Thank you for delivering the information that you did today. The thoughtfulness that has gone into the formulations is just so it really just blows my mind. So thank you for delivering that information to us and making these available. So I have loved our time together today. I have one question I ask all my guests at the very end of our discussion. I know I'm left with more questions, but I think you're going to have to do a part 2. I'm just saying,
I'm always happy to. There's always so much more to talk about. Yeah.
There always is. Okay, here's my final question for you today, Dr. Scott Sherr. Knowing what you know now, what would you tell your younger self?
How old?
You decide.
Very simple, yet very complex on the same level. You're not going to get as far as you think you are with only this part of your anatomy, your brain. I thought that you could just power through intellectually, because I was always very good at school. I always got good marks. I always thought that I could find and start businesses and things like that if I just used my brain. But I realized, like we were talking about earlier, that there's 70,000 to 120,000 thoughts that are going on there every moment. And if you just trusted that was going to be a problem and get you into trouble. And it did. I failed a number of times in my late 30s and early 40s with various things that I thought were going to work, that I put all this time and all this effort in. And I realized, no, there was much more to this world, to this living, to this being, to being, in this world, than just what you can get to mentally. So it was a big shift for me, learning about meditation, about mindfulness, about even psychedelics and other aspects of understanding that we are all very much in this world together. And one of the missions at Transcriptions, at Home Hope, is that we're looking to relieve in suffering in others and ourselves, knowing that there are no others, kind of deal. And so the idea with Home Hope, the idea with Transcriptions, is to do that, to relieve suffering, knowing that there really is nobody else other than you, because we're all connected. And when that became a big part for me, that changed my whole outlook, my whole way of showing up in the world. And a big part of this also, to be honest, was having 4 kids that I couldn't control. And so knowing that you don't have control, that free will is probably not the case. These are all very important things to surrender to the process. And so, yes, I would tell my younger self to get out of my fucking head and know that there's more out there that meets the eye. And that would be the big advice.
I love it. And control is an illusion anyways, right?
It is.
It really is. Thank you for the time today. I'm blessed to be in your space for this amount of time. Thank you, Dr.
The feeling is mutual.
Thank you. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.